Hi everybody. We have a unique chiropractic condition. A lot of people would not go see a chiropractor for a hiatal hernia. And why don't you tell people a little bit about what you're suffering from?
Been dealing with this for almost 2 years. A lot of acid reflux, bloating, early satiety. I've had stomach ulcers in the past. Can't seem to heal it with regular gastro.
He's got a lot of associated things going on with the ulcers and the acid reflux. He's also on medication. This is our first time seeing him. He's got a grade 1 sliding hiatal hernia, and we're going to go ahead and put it back in and slide it back down. We just finished doing cold laser therapy on him. I don't know if you noticed any difference after. It's only our first laser therapy treatment, but that can heal and repair, not only heal and repair soft tissue damage, but it can reduce inflammation and pain. So we did that first just to make this a little bit more comfortable, okay? So we're gonna go ahead and feel for his rib cage and then go right underneath here and just try to relax. Relax your stomach and arms at your side, yep. And I want you to take a deep breath in and blow out. Okay, was that uncomfortable?
A little bit.
Okay, and deep breath in and blow out. You okay? Mm-hmm. All right. And just try to relax. Just try to relax your stomach as best you can. I know it's not easy. So what we're doing is we're trying to get underneath there, and after he takes a big deep breath in, trying to slide it back down. Okay, and go ahead and take a deep breath in and blow all the way out. And again, deep breath in and blow out. Okay. And again, deep breath in and blow out. You all right?
I'm good.
All right, take another deep breath in and blow out. All right, that's it. We're gonna do this a couple of times over the next few weeks, along with laser and also some adjusting in the thoracic spine. Thanks for watching.